Good day, everyone. Many of us get confused or scared when the doctor tells us we need to undergo medical tests. What exactly do CBC, FBS, or PBS mean? Why do we need to fast or not eat? And how many times will we be pricked by a needle if many tests are requested? Please don't worry. I'm here to explain these in a simple way. These tests are like a window into our bodies. They give us and our doctors important information about our health. It's important that we understand their purpose so we can be more at ease with the process. One of the first questions is about the number of needle pricks. If you've been asked to get many tests like CBC, FBS, lipid profile, and thyroid panel, the good news is that usually you'll only have your blood drawn once. That's just one prick. The medical technologist will use one needle to draw enough blood to be put into different tubes. Each tube is for a specific test, so it doesn't mean that if you have 5 tests, you'll be pricked 5 times. This is a common process done to reduce discomfort and make blood extraction faster for the patient. Now let's talk about fasting. Why do some tests require it? Fasting means not eating or drinking anything except water for 8 to 12 hours before the blood test. This is done to ensure that the test results are not affected by the food and drinks we've consumed. For example, eating sweets before a fasting blood sugar (FBS) test will naturally raise your blood sugar level. This can give a false result and lead to an incorrect diagnosis. So following fasting instructions is very important for accurate results. Following your doctor's instructions before a medical test is key to getting accurate results. If it says you need to fast, please follow it carefully. If you have medications you take regularly, ask your doctor if you need to stop them temporarily or if you can take them even while fasting. Open communication with your healthcare provider will help avoid any confusion. Remember, these tests are done for your benefit, to help you stay healthy and to identify any problems early. Don't be afraid, this is part of taking care of ourselves. Let's go through common blood tests one by one so we can understand their importance better. The complete blood count, or CBC, is one of the most basic and frequently requested tests. It examines the 3 main types of cells in our blood: red blood cells, white blood cells, and platelets. Red blood cells carry oxygen throughout the body. White blood cells fight infections. Platelets help blood clot to prevent bleeding. A CBC can help identify conditions like anemia, infection, or bleeding disorders. Fasting blood sugar, or FBS, measures the amount of glucose or sugar in your blood after at least 8 hours of fasting. This is an important screening test for diabetes or pre-diabetes. A high FBS level could mean that your body isn't using insulin properly, which is the hormone that controls blood sugar. Along with this, a lipid profile is often requested, which measures cholesterol and triglycerides in the blood. This is important to know your risk for heart disease. These tests require fasting for accurate results. The thyroid panel is a group of tests that check the health of your thyroid gland, a small gland in your neck that controls metabolism. This includes measuring hormones like TSH, T3, and T4. If your thyroid is overactive, or hyperthyroidism, or underactive, or hypothyroidism, it can cause many symptoms like weight changes, fatigue, and mood swings. This test is critical for diagnosing and managing thyroid conditions correctly. It doesn't always require fasting, but always ask your doctor to be sure. Lastly, we have tests for vitamin B9 or folate and vitamin B12. These vitamins are important for making red blood cells and for the health of our nervous system. A deficiency in these vitamins can cause a type of anemia called megaloblastic anemia, which results in fatigue, weakness, and other neurological symptoms. The peripheral blood smear, or PBS, is a test where a pathologist examines the appearance of your blood cells under a microscope. This is often done when there are abnormal CBC results to see the shape and size of the cells and determine the cause of the problem. We often hear medical terms that we don't fully understand. Let's clarify some of them. NPO is an acronym that stands for nil per os, a Latin phrase meaning nothing by mouth. This is stricter than simple fasting. When it says NPO, it means no eating and no drinking anything at all, including water, unless otherwise specified by the doctor. This is commonly used before surgery or certain specific medical procedures to prevent complications. FBS, as mentioned earlier, is fasting blood sugar. This refers specifically to the test that measures blood sugar. The fasting in its name is a reminder that you need to fast before the test. It's important to remember that when it says fasting, it doesn't mean you're not allowed to sleep. In fact, it's better if a large part of your fasting period is while you're sleeping at night. For example, if your test is at 8 in the morning, you can eat your last dinner at 8 in the evening, sleep, and then go straight to the laboratory upon waking up without eating or drinking coffee. PBS stands for peripheral blood smear. It's not as common as CBC, but it's very important when abnormalities are found in blood counts. In this process, a drop of your blood is spread on a glass slide, stained and examined under a microscope. The specialist looks at the appearance, size, and shape of your red blood cells, white blood cells, and platelets. A PBS can help diagnose diseases like thalassemia, sickle cell anemia, leukemia, and other blood conditions that cannot be easily seen with just a CBC. When exactly do you really need to fast? Usually it's needed for FBS and lipid profile or cholesterol tests. For other tests like CBC, thyroid panel, or kidney function tests, it's often not required. However, the best thing to do is always ask your doctor or the laboratory. They can give you the most accurate instructions based on the specific test you are getting. Following these instructions is not only for better results, but also for your safety and proper care. Now let's talk about two different conditions that are sometimes mistaken for each other due to overlapping symptoms: thalassemia and thyroid problems. These two have different causes and require different treatments, so it's important to understand their differences. Thalassemia is a genetic blood disorder. This means it's inherited from parents. In this condition, the body doesn't produce enough hemoglobin, the protein in red blood cells that carries oxygen. This results in anemia, which causes severe fatigue, weakness, paleness, and difficulty breathing. On the other hand, thyroid problems are related to the thyroid gland. Hypothyroidism, or an underactive thyroid, happens when the gland doesn't produce enough thyroid hormones. These hormones control our body's metabolism. When there are not enough thyroid hormones, metabolism slows down, also causing fatigue, weight gain, feeling cold, and dry skin. You'll notice that fatigue and weakness are both symptoms of thalassemia and hypothyroidism. This is where what we call symptom overlap occurs. The reason for the similarity in symptoms is that both affect the body's energy use. In thalassemia, there isn't enough oxygen carried by the blood, so the cells can't produce enough energy. This causes fatigue. In hypothyroidism, the entire process of energy creation and use, or metabolism, slows down due to hormone deficiency. Even though the feeling of tiredness is the same, the source of the problem is different. One is in the blood, thalassemia, and the other is in the hormones, thyroid problem. Because of this symptom overlap, accurate medical tests are crucial to determine the true cause of what you're feeling. It's not enough to base a diagnosis solely on symptoms. If you're experiencing severe fatigue, you need to be examined by a doctor. They might request a CBC and PBS to check for the possibility of thalassemia or another type of anemia. At the same time, they might also request a thyroid panel to check your thyroid function. This shows why tests are important. They help the doctor differentiate between conditions with similar symptoms so that the correct treatment can be given. The most important lesson we can learn from all of this is the importance of being an active partner with your doctor in managing your health. Please don't hesitate to ask questions. If there's a word, test, or instruction that's unclear, ask immediately. There's no question that's too small or embarrassing when it comes to our health. Understanding the purpose of each test and what the results mean empowers us to better understand our bodies and make better decisions with our doctor. Self-diagnosis using the internet is dangerous and should be avoided. To make your doctor's visit more effective, here are some practical tips you can do. First, bring a list of all medications you are taking, including vitamins and herbal supplements. Also include the dosage or how much you are taking. Second, prepare a list of your questions before you even enter the clinic. This will help you not forget anything. Third, after the test, take time to rest, especially if you fasted. Eat nutritious food and drink plenty of water to regain your strength. Understanding medical tests is an important step towards better health. It shows that symptoms like fatigue can come from various causes, and only proper testing can point in the right direction. CBC, FBS, thyroid panel, and PBS are just some of the tools doctors use to help all of us. Collaborating with them, following instructions, and having open communication are the foundation of successful healthcare. Lastly, I want to remind you that it's okay to ask questions. It's okay not to understand everything the first time. The important thing is that we have the desire to learn and understand. Your health is your most valuable asset. Understanding the medical testing process is not meant to scare us, but to give us knowledge and control over our own well-being. Always consult your doctor. Work with them. Together we can better take care of your health. Thank you very much, and let's all take care.